Dupree. Have you guys ever watched Jane the Virgin? Jane the Virgin is a show where Jane goes to her gynecologist just for a normal checkup, but she ends up getting pregnant. This is a great plot twist for a show, but this happens multiple times in real life. This is an example of medical negligence. Medical negligence is when a medical practitioner fails to provide the care which is expected, which sometimes leads to injury and even death. And according to Johns Hopkins, medical negligence is the third leading cause of death. And more than 250,000 people die a year just because of medical error. Medical negligence could have such a devastating consequence, and it is a critical issue in America. During this presentation, I will show how this could be prevented if doctors were to listen to their patient more correctly, identify the patient, and even effectively operate on a patient. Did you know only about 1 in 3 doctors give their patients the opportunity to explain their condition? Doctors not talking to their patient effectively have caused them to misdiagnose their patient or even give their patient the wrong medicine. If all doctors gave their patients the chance to explain their condition, medical negligence will decrease extremely. A study has shown that most doctors give their patients an average of 11 seconds. Don't you know how fast 11 seconds go? It's pretty fast, which limits the patient's opportunity to explain their procedure, and most patients feel like they don't have no voice. 69% of the time, doctors ask patients closed questions like yes or no, which causes the patient not to have the opportunity to explain their syndrome. Can I please have a volunteer so I can demonstrate this? You can come sit here. I will be the doctor and she will be the patient. First, I'm going to show you how normal or average doctors do things in 11 seconds. Good afternoon, I'm Dr. Dupree. The nurse has informed me that you have a stomachache. Is that right?
Yes.
You see, the doctor did not give the patient the opportunity to explain herself. It was more of a yes or no, and the doctor would just start medicating her, which is wrong. Let me show you the correct way that doctors should do things. Good afternoon. I'm Dr. Dupree. Can you please state your name and date of birth?
Jean, December 11, 1988.
Okay, so the nurse has informed me that you have a stomachache. Is that right?
Yes.
Can you please show me where it hurts?
Right here.
Do you feel any cramping or pain?
Very badly.
Okay, so I will just be giving you some, and then I'll just give her the medicine that goes with her symptom. Thank you so much. The solution to this is giving the patient a voice to explain her pain and also allowing her to explain her symptoms. Next problem that occurs is doctors getting the wrong medication. Visualize this scenario. Where a patient is laying down for hours in an operating table, unconscious. The doctor has made her incision, punctured an artery, and already stimulated the heart. While the doctor is electrocuting the heart, she gets a call where she says that she got the wrong patient. So she checks the heart, and obviously that she had got the wrong patient. This has happened multiple times where the doctor has got the wrong patient because the doctor did not check the chart. The doctor has a faith in the team, the nurse, to give them the right chart, which causes them not to get the wrong patient. Many times people say it's because most patients have the same first name, but that should not be the case. As doctors, they learned that in med school that the doctor should have asked for the patient name and date of birth, and also the doctor should have asked the patient the procedure and talk to the patient just to know that it is the right person that they're doing the operation. Researchers analyzed 1,752 patient cases for which shows that 1,601 of them has mistaken their patients. The last issue is that medical practitioners sometimes leave objects in a person. In the United States, about a dozen sponges and other surgical instruments are left inside a patient's body every day. And 25% of the time, surgical instruments are left inside of the patient. In the news, they showed a case where a doctor left 2 sponges inside of the patient for 6 years. 3 years later, the patient started feeling many symptoms and difficult pains in their stomach area. So the doctor did an x-ray on the patient. The first picture shows the x-ray. The second picture shows both sponges. And the third picture is when the patient undergoes surgery where the doctor removed the tissue that had the sponges inside. The way that the doctor should have done it was when the doctor is doing the operation, the doctor should have counted how many sponges that the patient had. Which means that the doctor should have, after the doctor closed the patient, the doctor should have counted, and before the doctor even started the procedure should have counted. In conclusion, we have learned that medical negligence is a problem in our society. It can be solved with 3 main solutions. First one, pay attention to your patients. Second one, give the patient correct time and also find out if it's the right patient by checking the charts. Third one, effectively operate on the patient by making sure that the sponges are good. I want to stop this presentation with a good quote. A good doctor confirms and reassures. Reassuring words are sometimes more powerful than medicine. So pay attention to your patient.